Home Health Aid Bag Technique. Medical asepsis in home care. Purpose. This procedure provides instruction for the use of equipment bag. It is used to carry out the principles of medical asepsis when providing patient care in the home setting. Bag technique will aid in prevention of cross-contamination. Provide for a clean area inside the bag to keep needed supplies and equipment. Provide for a well-stocked bag that will aid the nurse in accomplishing the plans for the visit. Prevent contents in the bag from being damaged or lost. Supplies to be included in clean area of bag. Clean area supplies. Disposable gloves, in plastic bag, Clorox wipes, safety eye shield, alcohol pads, face mask, gown, CPR mouth shield, outer pocket, soap bottle, paper towel, waterless antiseptic hand solution. General guidelines. Important: the home health aid will keep the bag closed when not in use and will always keep it within sight during a visit. Never put bag on floor. While in the car between visits, the home health aid will keep the bag on a clean surface on the back seat. Essential practices. Hand hygiene: wash your hands before and after touching the patient equipment. Care clean equipment before and after each patient. Vehicle organization: divide trunk into clean, dirty areas. Protecting. The RN will provide for the protection of the bag. The RN is responsible for the safety of the bag and its contents. End of day storage. The RN will keep the bag in a clean and safe area in their home, especially important during hot, cold weather when supplies, equipment may be damaged by extreme temperatures in the car. Key takeaways for safe and professional home care practice. Keep your medical bag closed and always within sight during visits. Never place the bag on the floor. Use a clean, designated surface. Perform hand hygiene before and after every patient interaction. Clean and disinfect all equipment before and after each use. Store your bag securely at the end of the day. Protect all supplies from extreme heat or cold. Maintaining medical asepsis leads to better patient care.